Hello and welcome. Around 1,000 women and 2,000 babies die every day from birth complications. But when so many of those deaths are preventable, why has the international community been so slow in taking action? It's a particularly crucial issue for the developing world, where access to health facilities are limited, forcing many traditionally to seek help from unlicensed attendants or family members. The results are often deadly. It's staggering to discover that in Ethiopia and other similar countries, more than 90% of pregnant women perform deliveries without a trained health professional. The UN's Millennium Development Goals aim to reduce maternal mortality 75% by 2015 compared with 1990. Now, even though some progress has been made, critics say that goal is unreachable and not enough is being done to provide protection for pregnant women. So today we ask, what specific action could help reduce the largely preventable deaths of women and babies through birth complications? Remember, you can join our conversation with your questions and comments. You can send an SMS or an email, and we also take your phone calls on the show. Joining me to discuss these issues is international supermodel, designer and World Health Organization Goodwill Ambassador Liya Kebede. Her work with the WHO has taken her around the world, promoting better awareness and care for pregnant mothers, newborn babies and children. Liya Kebede joins us from New York. It's good to speak with you again.
Hi, it's nice to speak with you as well.
Liya, what drew you so passionately to this issue of maternal and child and newborn health care? What was it that really drew you to this so passionately?
You know, in 2005, the World Health Organization actually approached me to do this, to be a spokesperson for this. And basically they came and said to me, every minute one woman dies of pregnancy and childbirth-related complications, and 90% of these deaths are preventable. You know, and I'm a mom, I have 2 children, I'm from Ethiopia, and Ethiopia is a place where I grew up knowing a lot of women dying from childbirth, and I thought that was very common there. I thought it was a normal thing until I came here and realized that actually most women don't die from childbirth here, and that almost all those deaths are preventable. I think I just wanted to really do whatever I could to help with that.
Now it's interesting. You of course your roots are Ethiopian, and you've had a rather unique and incredibly successful career in the West. I know you have a lot of connections with Ethiopia and do a lot of work helping people there. I'll talk about that a bit later in the show. But let me ask you, when you go back, how easy is it for you to relate to the women there and the issues they face?
You know, it's actually really difficult because every time I go there and I'm sitting with women who just gave birth or who of kids who just lost their moms or husbands. I met husbands who lost their wives and women who've lost their daughters to childbirth. It's really difficult to sit there because you know that if they were in the West somewhere, they would have probably lived, and they died from very simple things, from an infection or a hemorrhage or the baby was too big and they had nowhere to go. There's no clinic, there's no hospital, there's no skilled attendant. Like you said, most women deliver with either their mother-in-laws or by themselves in a hut, and they had no water, and the baby's just, born on the ground, and it's very difficult to sit there and see them and not be able to do something about it.
Right. Now it's interesting, you were saying how you'd been approached and were told one woman dies every minute. I think the number of babies dying is even higher, according to those figures. When you consider that so many of these deaths are preventable, and the UN has set those Millennium Development Goals to reduce the mortality rate by 75% by 2015 compared to 1990, why has it been so hard to reach those goals from what you've seen?
But somehow maternal mortality is not an issue that is addressed. It's not on the agendas. It's not prioritized. It's not getting the funding that it requires. I think it's mostly probably because the solution is a bit more comprehensive. You're required to invest, some money to infrastructure, because you have to build hospitals, you have to build clinics, you have to invest in training skilled attendants and all these kind of things. But the upside of all this is that once you have those set up, these are systems that will be used for everybody. So in a way, by trying to save mothers, you are really saving everybody else, because everybody's getting access to these facilities. So it's an investment that needs to be done. But like you said, even out of the MDG goals, maternal health is the one that's probably not going to make its goal. It's really sad.
Let me put a question that we got from Uganda, from a viewer in Uganda who sent in this question for you. Fahmi Ibrahim wrote in saying, what will it take for governments in Africa to improve the healthcare sector? Now, of course, considering how well African countries are doing, or many of them are doing economically, and the continent is rich in natural resources, why is it that it's a shame, why is it that those who have their fingers on the purse strings are not being encouraged to spend more on the health sector?
Well, that's, you know, in a way, you know, that's why I do what I do in a way. It's because it's trying to really bring that, you know, to the forefront. Is try to talk to them and say, you really have to focus on health and especially on women's health, because the problem is, you know, when you're not investing in mothers, once a woman, you know, dies, you know, you're leaving the whole family. The woman is leaving children behind. Who's going to, you know, who's taking care of those children? Those kids are going to be probably more likely not to be educated. They're not going to get proper health care. They're going to be malnourished, you know. So in a way, trying to, as we're going forward, trying to break the cycle of poverty, I don't think we can do it without saving the mothers, you know. So it's really, really important for actually developing nations leaders to really focus and prioritize funding for this.
You know, I want to ask about your work as an ambassador for the World Health Organization, because that's taken you around the world. I wonder what you've learned from that personally, from what you've seen, especially when it comes to the challenges that women face. I mean, sometimes it is the simplest things that can cost a woman her life, like just getting to a clinic, or, you know, being in a rural location, not even being able to get to a location where she can get help, isn't it?
Yes, I mean, you know, it's. I was just actually. There's a story I always talk about. Is, you know, I have a friend of mine who gave birth here in the U.S. who is Ethiopian, you know, and she had high blood pressure, and so she had a premature child, you know, but the thing is here, it's a very normal phenomenon. You know, they take care of you and you're fine and the baby's fine, and not only that, she was able to go ahead and have a second child, and she was closely monitored, and you know, when she was in her second trimester, she was asked to be on bed rest, and that was really it. High blood pressure is one of the major killers of women in developing nations, in pregnant women. It's one of the major killers because women don't know what to do with that. There's a premature baby, they don't realize it, and it causes them their life. So it's simple things, just knowing this alone would save so many of these women's lives, you know. So yeah, it's that one little thing that determines whether you live or die. It's really sad.
Right. Another email question here for you, Liya, if I can. This one came in about the need to access healthcare, and this came from a viewer by the name of Christina Howarth, who wrote in saying, modern medicine has undoubtedly saved many lives, but until women have unrestricted access to reproductive health care, maternal and neonatal mortality will persist. Now, I wonder, that lack of access to safe and effective contraception, for example, is an issue, and there are a lot of women who die from illegal abortions. And I wonder, when it comes down to it, how much the issue of religion and religious sensitivity has been a factor when you've been traveling around, you know, African countries trying to get this message across. How much do you have to deal with those kind of religious and traditional sensitivities?
I mean, I think every time you're trying to bring on change, you know, that's going to happen. I mean, I haven't been faced with that a lot. I mean, I know, for example, I remember going and seeing this woman in Ethiopia, in this Barda region, who had about, you know, 5 or 6 children, and she was telling me about how she wanted to raise her own children now, and how she really didn't want to have any more kids, and, you know, it wasn't really her choice because they didn't have contraception. So every time, you know, they basically, you know, she was with her husband, you know, she would get pregnant, but she wouldn't have enough money to feed her children. And then all of a sudden, now that she was aware and educated, and she was in this program where they were giving her contraception, she realized that she didn't have to have any more children that she could feed, you know, and that kind of empowerment is you know, is really necessary. And she was telling me as well how, you know, now that for her daughter, she wanted a different life for her daughter. She wanted her daughter to go to school and stay in school and finish school, and not even worry about getting married if she didn't want to. And that was a huge accomplishment, I thought, you know, to hear her say something like that. Now,
of course, you know, your roots are Ethiopian, and you're able to go there and people can relate to you because you're from the country itself. But to what degree do you find that there is a tendency for people in Africa and countries in the developing world across the globe to reject or sometimes be wary of Western dictates? That's to say, you know, could there be a local way of handling things rather than making people feel that this is what the West thinks you should do, or this is what the outside world is trying to impose on you?
You know, I think it's all about on how you do it. I think it's always, obviously, if you just go and try to tell them how to do things, it's not how you would get the right solution. I think it's about going in there and working with the community, and also the thing is, there's so many you know, local communities and local NGOs that are working on the ground with the communities and everything, that are doing such a good job. I think it's about going and supporting them and giving them the funding or whatever help that they need to be sure that, you know, the message gets across. And I think it's important to understand the lay of the land and you know, come up with a solution that from their side and from your side together.
You know, interesting email that came in on an interesting topic from Pakistan, where Uzma Iram wrote in saying, in many cases, men control the rights of women. How can we help males become more sensitive to the issues of maternal health? That's crucial, isn't it?
Yes, it's very crucial. I think education is the key. You know, you have to educate not just men only, though. I think women also have to get educated about it, because you have no idea how many women never even think of going to a clinic when they're pregnant. You know, it's not, they don't know that they're supposed to go. So they don't do any prenatal checkups or postnatal checkups, or they don't even go to the hospital to deliver. They think that you only go to a hospital when you're on an emergency level, which means way too late. You know, by the time where they realize that, oh, you know, the baby's too big and they can't deliver, and they try to go to the hospital, at that point it's already too late, and they would, you know, most of them die on the way. So even educating them about the importance, and just for them to be aware, and the men as well, is important. Yes.
It's interesting because I came across an interesting piece of information. In Nigeria, for example, a third of the women there said the reason for not going to health facilities is because their husband said it was unnecessary. Now, again, you're coming across this cultural issue of the man being very much in charge. So apart from what you were saying about people not understanding why they need to go, there is still that male dominant factor, isn't there?
Yes, unfortunately, in some areas, yes, it's a difficult one to tackle.
We've got an email that came in from Algeria, from Sharif Ag Mohammed, who wrote in saying, women regularly give birth without any assistance at all in sub-Saharan Africa. Many cases of mother and child mortality are tied to the politics of the local leader. Now, we've been touching on this just now about that, you know, the women wanting to have their children at home. In some countries, it's considered almost far more necessary to have them at home. To, you know, it's a cultural thing. But in terms of, in some of these areas, they're depending on people who use local herbs rather than, you know, sort of real, more potent medicines and issues such as that. And I wonder how much that issue of cultural indoctrination, using unexperienced local carers and attendants, perhaps family members, can be overcome. At what point can you insert that education that teaches them, listen, it can be more than this?
I mean, you know, like, you know, it's, again, like I said, it's really about educating. It's about, you know, community outreach. I think there has to be a lot of work done there. I mean, half the work is to make sure that women feel comfortable enough to come to hospitals and to get the treatment that they need. You know, it's not understanding what the hospitals can do for them. It's not understanding. But now, for example, if you take the example of in Ethiopia, they have this program about health extension workers, which I think is really fantastic, where they're taking young girls from the region and teaching them about, you know, prenatal care, postnatal care, or going in and making sure that if they see at-risk pregnancies, they can then refer them to hospitals and things like that, educating them and all of that. So it's women coming from their own communities coming in and educating them on, you know, how to handle their pregnancies. I think it's changing the way they will experience their pregnancies, you know. Right, so yeah. I think a lot of that kind of work has to be done to make them comfortable, because in a way, it's true, if something new happens in your area and they tell you come and do it here, you're not going to do it if you don't really understand what it is that, you know, you're going to, what kind of benefits you're going to get out of it.
Okay, we have a call from Maine. We have Karen on the line. Could Karen go ahead with your question, please?
Well, it's just an idea. I wonder what you think. I think if we're honest, the UN and the West and the global communities, and especially the corporations, are not concerned with women and children of Africa, only the natural resources, the minerals and the oil. And so it just goes on. And that's just what I'm... Just a suggestion.
Yeah. Thank you very much, Karen. I just wonder about that, Liya, your views on what has largely been what many consider the exploitation of Africa for its natural and mineral wealth, of course, and yet issues such as maternal health care is just so sidelined.
I mean, that is what, you know, that's why it's so important that we all talk about these issues like maternal health, because it's not being, you know, given the attention that it deserves and that it needs. You know, we do have to fight to keep those things on the agenda.
We've got Richard on the line from Zambia. Richard, are you with us?
Yes, I'm with you.
Great, good. Thanks for being on the show. What would you like to ask?
Wonderful. I just want to make a comment. 9 out of 10 of Africa's problems are poverty. Until we erase poverty, we are not going anywhere. We agree with Liya, we agree with you. The major issue that we must actually go into aggressive revolutionary measures of erasing poverty. That's the solution. These kids whom you are talking about maternal health care, they are fathered by fathers, and fathers is us. So we must take the action.
Right.
We need you, Liya and Riz Khan. We want the banks to lend us money to invest into agriculture. That is the most important thing. Thank you.
All right, Richard, thank you very much for that. Richard calling in there from Zambia. Interesting point he made again, of course, about men being much more involved. But Liya, on this issue of, I mean, Africa has wealth. That's the interesting part. I know, of course, you've been working much more at a grassroots level. What kind of improvements have you seen with the work of your foundation? When you go back and you do the work there, what kind of change have you seen, and how could that be scaled up to have far more impact if, say, governments got involved or bigger NGOs?
Well, you know, I will talk about, you know, again, this example of health extension workers that is going on in Ethiopia, that has come from the Ministry of Health there, and is really an example that we can look at, because what they've done is they have now dispatched about 30,000 health extension workers. So they have pretty much put 2 young girls per village that then are responsible for that village, and then it sort of scales up into another, you know, one other health center that then oversees about 5 of them, and then they refer it over to the hospital and things like. So it's sort of, you know, there's kind of come up with a system where everybody is sort of covered that way, and I think those kind of strategies, and when the government sort of puts its foot down and decides to implement something, it really gets done, and you see the difference, and you see these women that are now being educated and now understanding what's going on, and, you know, now understanding that now that they're pregnant, they will go and check you know, and a health extension worker, and see her before, you know, for their prenatal checkups, and also like making sure that their kids get vaccinated afterwards, for example, and learning about breastfeeding, and all of that comes with all these things, you know. So I think I have seen that working, and I've seen that, you know, making a difference in women's lives, which is really wonderful. Yeah,
a comment that came in actually on this issue of education came in from the USA, from Vinotini Sundaram, who says, in order to tackle the issues of women's and newborns' health, poverty and lack of education must be addressed first. Only then can real change be seen. Of course, that's a common theme now, education and poverty, you know, solving poverty issues. Now, in terms of tell me a little bit more about what your foundation does, though, in terms of what you've seen on the ground.
You know, we work a lot with local NGOs and really helping them, you know, do their work that they do better, you know, help them in funding, help them in raising awareness of this problem. It's making sure that, you know, the world talks about maternal health and sees that it's one of the things that is not addressed, and that international donors actually do earmark, you know, specifically for maternal health funding. Actually, President Obama has promised about $700 million for 2011. And so it's our job to make sure that Congress passes it, and so, you know, to get everybody with us to make sure that happens, and that other international organizations and international governments also start funding specifically maternal health. You know, those kind of things is what we do.
And of course, it's important, I guess, for you to have the, you know, the celebrity factor. You go back to Ethiopia as an Ethiopian who's done very well. And Ethiopia, of course, is a country which I think has one of the highest numbers of women who give birth with no skilled help.
Yes, yes, it does. It does. We're hoping to change that, I hope.
Now, let me ask you about you've developed a clothing line, Lemlem, which works with the grassroots Ethiopian weavers. Tell me how that works and how that has also been beneficial.
You know, Lemlem sort of happened because I went back home and I was visiting all these areas, and I visited this area where we had all these weavers, and, you know, traditional clothing has always been made by weavers, hand-woven. And but they were now not really having any market for their products anymore, because everybody's wearing, you know, machine-made clothes. And so I thought that maybe there was something I could do there, and I started Lemlem, which means to bloom in Amharic, where they were actually designing like sort of, you know, very trendy style clothing, but made, you know, by hand and woven by weavers in Ethiopia, and then having it come here and you know, marketing it here. And the hope is that by showing that we can bring really beautiful products from Ethiopia and Africa, is that other companies can sort of use it as a role model and go in and then start hiring more people and start opening up factories and really help us with you know, developing that economy.
Well, you know, there's a call from Dubai on the line. I want to get that in. Lena has joined us. Lena, go ahead, please.
Hi, this is Melina. I'm calling from Dubai.
Hi.
Hi, Liya. I'm from Ethiopia as well.
Hi.
The thing is, I myself coming from that generation, my mom married at 13 and had me at 15. and she happens to be one of those few women who survived this. But again, what I'm trying to tell you is the whole thing is based on religion and culture, I think. So I think the education started from there, and the rural areas mostly ruled by chiefs or other cultural things. I think we should go and tackle that as well.
And actually, that's an interesting point you make there, Melina. That's true, Liya. This is something we were talking about a little earlier in the program. The need to be able to navigate the complication or the complicated territory of traditions, cultures. In this case, perhaps tribal patterns and chiefs. How much do you find that your experience, of course, with your Ethiopian roots, allows you to be able to show the right level of sensitivity when trying to make headway there?
I think definitely. I mean, she's right. I mean, you're right in what you're saying. It is sensitive. It is complicated. But I think educating is the only way out. I think we have to educate. But the thing is, once you've educated them and then you don't have the facility where they can actually go and use a facility, then it's sort of you haven't really helped them much anymore, so it's kind of, I feel like it all sort of goes hand in hand. The other man from, I think it was from Zambia, was talking about, we have to first eradicate poverty. Yes, we do, but how do you eradicate poverty if you can't give, proper health to your population, or you're losing half of your population or mothers all the time, and the children are left without mothers. I mean, it's kind of a thing where you can't do one and not do the other. I think you sort of have to try and do a little bit of everything at once,
I guess the key is it being sustainable, and the idea that it's not just about treating the symptoms but treating the cause, going through education and this grassroots level.
Yeah.
Let me ask you one thing, while we got you for a few moments more, just about your new movie, because I know you keep very busy with, apart from the clothing line, the foundation work and everything else you do, the goodwill work. Let me ask you about Desert Flower. That's an interesting story because that touches on another issue that is very still prevalent in parts of the world and especially in parts of Africa. Desert Flower, the story which is based on the story of Waris Diri, another model who went through female genital mutilation, genital circumcision as it was called. Tell us a little about that movie, because I think you're playing the lead role in that.
Yes. It's interesting. I first discovered the story of Waris when I read her autobiography, the Desert Flower book, and I was really surprised. I mean, first of all, to find out about, even to that extent, at least, about female genital cutting. I wasn't really aware that much, even though I grew up in Ethiopia, and it happens in Ethiopia. Not in the city, though. It happens mostly in the countryside, so we're not really close to it, growing up. But I think for me, reading it in that book is sort of when it opened my eye to exactly, how difficult this practice is on young girls. And but at the same time, it was a story that, she inspires you, because we all grow up, we all have obstacles, and it's how we deal with them that makes us who we are. And I think she found a way to deal with it that was incredible. She's the first woman to ever talk about it. And since then she's been advocating it, and
yeah, we had her on the show.
It's a really,
she's very forthright. We had her on the show,
did.
and she was very good at expressing, of course, the horrors of what goes on and the issues and the difficulties in tackling it. Just but with 30 seconds to go, let me ask you what you learned, what lesson you got out of doing that movie. It opened my eyes on a lot of things, and I find like she inspired me. I think she sort of sort of makes you understand better that life is sort of what you make of it and not what it makes of you. Well, Liya Kebede, it's great to have a chance to chat with you again. Thank you very much, and thanks for your hard work, of course, on the issue of maternal health care. We'll be keeping up with what you're doing. Thank you for being with us on the show.
Thank you so much for having me.
And thank you for sending in your questions too. If you want to know more about these issues, tune into Birthrights, a special Al Jazeera series all this month. On the next show, a challenge to democracy. Hopes that Nigeria might break the pattern of chaotic and corrupt elections have already been dealt a blow after polls were postponed due to a lack of preparation. Nobel laureate Wole Soyinka and novelist Chimamanda Adichie join us to examine Nigeria's political future. Make sure you tune in for that. From me and the team, we'll see you next time.